Hello everyone, I'm Dr. Anuj Taneja, Specialist Dermatology at Aster Clinic, Silicon Oasis, Dubai. Today I'm going to talk about a common procedure called Botox, which is used for facial rejuvenation. It's a very popular procedure and it's commonly carried out throughout the world. A little background about myself. I'm a doctor trained in dermatology and venereology way back in 2004. After that, I've got extensive training in aesthetic and cosmetic dermatology for the last 15 years. I have been well trained in Botox, fillers, plasma, laser for facial rejuvenation, mesotherapy and the like. And today, one of my favorite procedures is Botox. So I'm going to talk more about Botox today. So the commonest question that people ask me is, what is Botox? Is it a toxin? Well, not entirely. Botox is a purified protein which is derived from animal fermentation. It's extremely safe. It's given in small doses at required places where it causes the relaxation of muscles. The muscles relax and give the desired look to the face. Now, who are the suitable candidates for this procedure? As we know, today we have a very busy and hectic lifestyle with all the stress and pollution, which causes wrinkles to appear very early on the face. So anyone desirous to have a pleasant face can opt for this procedure. Now, the commonest areas where the Botox works very well is the upper face. In the upper face, we have got three concerns: the forehead lines, the frown lines and the crow's feet. Now, what are the forehead lines? The forehead lines are the lines which appear on the upper part of the brow. This causes a very anxious look to the patient. The frown lines appear in the glabellar area and causes a very angry look, and the crow's feet appear on the side of the eyebrow, on the side of the eye, and give a very tired and a very aged look. Now, Botox works excellent in all these three areas. So if you want to know that you are a right candidate, you can take a consultation with the doctor and he would guide you through the process. Now, how is this process done? The person comes in for the consultation, he tells his requirements and we assess the face accordingly. After assessment of the face, the area is numbed with an anesthetic cream and it is waited for 15 to 20 minutes. After that, the Botox is injected in these areas with the help of a very small needle at the desired points. The process is virtually painless and the patient can directly walk out of the office and carry on his routine activities. Now, what are the side effects that we commonly encounter with this process? Sometimes patients are on blood thinners, which may cause bruising in certain areas. This bruising lasts for around 5 to 7 days and resolves on its own. Second thing that we commonly see as a side effect is, sometimes as a rare side effect, there can be a drooping of the eyelid, which can last for up to 2 weeks, but resolves with some eye drops. Other than that, we don't see any other side effects with this procedure. The results start to appear in 3 to 4 days and last for up to 2 weeks, up to 6 months. A touch-up can be done after 2 weeks if it is required by the person. Normally, what happens if we don't do the injections after 6 months? If we don't do the injections, the Botox effects tends to fade out with time and the wrinkles start appearing again. So a touch-up is really desired after 6 months when the wrinkles start appearing again. Other than that, there are no other side effects of this procedure. Now, the second thing is about the contraindications. Pregnancy is a big contraindication for this procedure. Other contraindications are persons having muscular problems like myasthenia gravis or persons who are on certain antibiotics like gentamicin. These are the persons we do not inject with this procedure. Other than that, it is a very safe and a very well tolerated and effective procedure. The results are very excellent, especially on the upper face, where we get a very relaxed and a very excellent, pleasant, relaxed face, and that adds to the beauty of the person. We have used Botox in other conditions also, especially on the lower face for the masseter hypertrophy and also for the smile lines. We have also used it in the neck in certain cases of platysmal hypertrophy. Other than that, it can also be used for axillary hyperhidrosis. Persons who sweat a lot in the axilla can benefit from Botox. So these are the common indications for Botox which we commonly use. It's been there for a long time. I'm happy to offer my services at Aster Clinic, Silicon Oasis. If you wish to get a consultation, feel free to walk in and I'll be ready to guide you throughout this procedure.